that everyone here has a baseline understanding of IVF or in vitro fertilization, as well as fertility treatments. However, if you do have a question that pertains more to general IVF, feel free to insert it into the chat function and we will make sure to address that question as well, or it always can be addressed at an initial consult with Dr. AUBUCHON at a separate time as well. So we have Dr. AUBUCHON, Mira AUBUCHON today, as well as Shawnee and Dale, who are all a part of the Matching Miracles and MCRM Fertility team. But I want to be sure to give a quick introduction to Dr. Mira AUBUCHON, who is a board certified in obstetrics and gynecology, as well as reproductive endocrinology. She provides unparalleled expertise in assisting patients with all sorts of fertility care, from IUI to IVF, including third-party reproduction as well. And she's just a lovely gem of a human also, if I may add. She also helps in educating the next generation of women's health professionals by being an associate professor of obstetrics, gynecology, and women's health at the University of Missouri-Columbia, Mizzou, and St. Louis University. So with that, I'm going to turn it over to Dr. AUBUCHON, who's going to lead us through the presentation today. And again, don't forget to submit any questions that you have via the chat function, and we'll be sure to answer them as soon as we can. So I'll turn over to you, Dr. AUBUCHON.
Thank you so much for that kind introduction. And I am very, very honored to be here today to talk about this topic that I feel very passionate about. And it's things to know when considering donor eggs. Myself and Dr. Allering work together to help patients achieve their family building dreams. And I joined MCRM in 2016, and I've been in patient care practice for many, many years. We have two locations. One is in Tulsa, Oklahoma. The other is in St. Louis. We see in-person consults and monitoring, and we also do remote telehealth visits to reach as many people as we can. My goal for today is to provide some education about the egg donor options that are available, to explain next steps, and then, as Stephanie mentioned, to answer your questions. Trying to conceive naturally can become more difficult as we move through our reproductive ages, as this slide shows. And thus that raises the question of when we should consider an egg donor. These are some various reasons that might be considered, such as previous unsuccessful IVF with a person's own eggs. Sometimes this is done to avoid transmission of serious genetic disease, or perhaps regardless of age, there may be very few eggs or no eggs remaining, as in the case of low ovarian reserve or advanced reproductive age. Some patients may be also at elevated medical or surgical risk to undergo the types of procedures that IVF would require, like an egg retrieval. They may have primary ovarian insufficiency, which is where the egg supply has been exhausted prematurely, or they may simply have no ovaries. They may have been surgically removed, for example, or they may be in a situation where they don't themselves have ovaries, as in the case of certain types of family building.
Dr. AUBUCHON, we had a quick question of someone asking if you found that one of these was more common than the other when using donor eggs as a reason.
I'm going to go back to that slide. I would say the most common reasons would be for previous IVF failures and for low ovarian reserve.
Okay, thank you.
Some things to know when considering donor eggs. The egg donor options we have available to us at MCRM include using fresh donor eggs with our Matching Miracles program, which is the focus of our talk tonight, as well as frozen donor eggs. And we partner with Donor Egg Bank USA, part of California Cryobank, for this option. Some advantages of using our Matching Miracles program is that the recipient family would acquire all the mature eggs that are produced by the egg donor, as opposed to having those be parceled out into portions and sent to different recipients. The timeline is generally faster, within a few months, and is all inclusive, as including what you see here.
We had a quick question around if you can just explain the difference a bit more between what just the basics of fresh versus frozen is.
Fresh eggs have not yet been produced and harvested. So the recipient family would choose an egg donor. The egg donor would undergo an IVF cycle. The eggs would be harvested, and then the recipient family would utilize all of those eggs for their own use. In contrast, frozen eggs have already been harvested. Prior to them being fertilized, they are frozen and divided into portions or lots. And those lots include smaller numbers of eggs, usually about 5 to 7. And those lots get distributed to recipient families, usually all over the country. So there are usually fewer eggs included.
Thank you.
With Matching Miracles, the embryos are stored on site. We have a dedicated care team. Myself and Dr. Allering work with your donor that you choose throughout the whole process. And we have a diverse donor database to choose from. The recipient mother workup includes an evaluation of the uterus, usually with an ultrasound, vaginal ultrasound with some water placed into the uterus, or a saline ultrasound to evaluate the inside of the uterus. Some blood work related to hormonal testing, as well as health screens and all the necessary medical items that might arise from the medical history. The clearances include the clearance from the OBGYN. Depending on the age, we may also ask a high-risk OBGYN doctor with a specialty in maternal fetal medicine to also provide clearance. There may also be requirements, depending on the state of the recipient mother, to have a psychiatric evaluation, as well as a legal clearance letter. For recipient fathers, they would undergo some sperm testing, which may include a semen analysis with an assessment of shape or morphology and a sperm DNA fragmentation, as well as genetic carrier screening, which is useful in terms of choosing a donor, infectious and hormonal screening, psychological evaluation, again, based on state, and then a legal clearance letter.
So Dr. AUBUCHON, we had a few questions on the last 2 slides. Can you explain a little bit about the definition of legal clearance? And then there's a part 2 to that question.
Sure. I think the lead third-party reproduction coordinator, Shawnee, would do a better job of answering this. So I'm going to turn that over to her.
Hello, everybody. Hopefully you can hear me. So the legal clearance letter is a letter that is received from an attorney that is basically stating that we have the all clear to move forward with the egg retrieval process on the egg donor that you all have matched with. So basically, depending on the state, is how detailed or the process should go with the attorneys. Matching Miracles has 2 attorneys under their program that are both based in Missouri but licensed in many other states, including Oklahoma. So they are very versed on all the family law matters that are needed to be handled in those type of contracts with an egg donor.
In the part 2, if you could go back one slide to the recipient mother, there's a question around what kind of test would you want the maternal fetal medicine physician to perform in order to receive clearance?
It's really as indicated. Usually this includes some type of cardiovascular evaluation in the form of a treadmill stress test, echocardiogram, EKG, and usually is also based on the medical history.
And so the person also asked if, so the legal clearance would just be for fresh eggs or for frozen as well?
The legal clearance is based on the state regarding frozen eggs, but for fresh eggs, there has to be a legal clearance letter before the process can undergo for egg retrieval.
Okay. You guys really got the audience going. I'm getting a ton of questions coming in, so we'll stick on this a few more till we get them answered because I think it's important. Does the donor workup include drug testing and a criminal background testing, criminal background check and anything else you'd like them to know?
So the screening is based on what is regulatory by state. We do screen per FDA regulations. A drug urine screen is included. A background check can be included if the recipients would like that to be done, but it is not required.
And then this question is about the recipient, back to the recipient father workup. What happens if the semen analysis does not show any viable sperm? What happens next?
Usually then a workup would be done for the recipient father in terms of hormonal screening and other screens to determine what a potential cause may be. If it turns out that there truly is not viable sperm to be obtained through conventional methods, then some consideration can possibly be given for surgical sperm extraction done by a urologist. This type of process is called a testicular sperm aspiration or extraction. Alternatively, the recipient father may even consider utilizing a donated sperm.
One of the questions is the recipient father workup included in the all-inclusive fee?
Yes, the recipient father workup, the semen analysis, the genetic carrier screening, the infectious disease, and the hormonal screening, and the psych evaluation, if it's required by their state, is included in the Matching Miracles fee. The legal clearance is also included in the Matching Miracles fee.
Another question is, which of the maternal screening tests is done on site, i.e. ultrasounds? Are they done on site somewhere else? And is there a maximum age for a recipient of donor eggs?
So in terms of where the evaluation is done, it typically is done at one of our 2 clinical locations, either in St. Louis or in our Tulsa, Oklahoma location for the uterine evaluation. The reason for that is it serves as almost a dress rehearsal for the actual embryo transfer. So it can be very useful in that regard to make a trip to do that. The blood work is fairly flexible as far as where that's done, but if they're already coming here for the uterine evaluation, then the blood work can be done as well. As far as the age with the recipient mother, some of this is going to be on a case-by-case basis, but we do have guidelines that are set out by the American Society for Reproductive Medicine in this regard. And some of this is also going to be based on maternal fetal medicine clearance. But generally, recipient mothers are under the age of 55.
And there was a question whether or not this will be recorded and available for later rewatch. Yes, we are recording this at this time.
Hi, everyone. I'm so sorry about that. The beauty of so many virtual meetings nowadays. Did you finish answering the question with the audience?
Yes, I went ahead and asked several of them.
Beautiful. I don't see any more questions, so Dr. AUBUCHON, I believe you can continue with the presentation.
Okay. So the next steps would be to schedule an initial consultation with either myself or Dr. Allering. And then after that, then you will be given access to our donor database, after which you can select a donor to undergo all the appropriate further next screening steps, and then establish a planned timeline. Once we are ready to go in that regard, then we would prepare the recipient mother for the embryo transfer, complete the embryo transfer, and then begin screening for pregnancy, which occurs as soon as about 7 to 9 days after the embryo transfer. And I'm happy to take any more questions, and I really thank you for your attention tonight.
Thanks, Dr. AUBUCHON. We do have a few more questions that have been coming in. Would you be able to discuss a bit more in detail about the donor selection process?
Yeah, I participate in the medical screening of the donor, but as far as other aspects, I'll have Shawnee start.
Hello again, everybody. So the process is pretty simple in regards to where you start, and that's just going to the database. You will see a profile of the donor that includes medical history of her family and herself. It also includes some photos of her. And obviously, if there's any additional information that you want on the donor that I'm at liberty to give you, I will reach out to the donor to get that information for you. Once you're placed under a contingent match, that's what brings the donor in for her screening process with Dr. AUBUCHON. She does do all the initial eligibility screening for the egg donors. But if you are a Dr. Allering patient, he will monitor the donor's care. And then basically that screening process takes about a week to get a lot of the information back. And then once everything is in on the male side of things and the donor side of things, you go under a final match for a retrieval cycle. And then in between that time is when I start sending everything to the attorneys so that they can get the contracts underway. And once they're finalized, we can confirm retrieval.
Awesome, thank you. So we have another question, and if you guys need more clarification, let me know. When do you accept our donor selection? Do you have to wait until genetic testing and sperm analysis come back before accepting?
So basically, a donor can be selected prior to undergoing that type of screening. It may be that based on the results of that screening, perhaps the donor selection may be adjusted. But yes, they can select a donor prior to undergoing the genetic type of evaluation.
And before the semen analysis as well?
Yes. But understand that if a donor is selected, it may be that if there are sperm issues, then there may be a delay in initiating the cycle if there is not sufficient sperm to create embryos.
sorry, not to interrupt. We also like that the recipient families have so many donors to choose from that we ask for what I call a top 5 list. So if the first donor they choose is not available or, you know, is ready to go, but, you know, we're still waiting on the male side of things, whatever the case may be, if it ends up not working out with the donor number 1 choice, then they have different options to choose from.
And in terms of sperm testing results, when the sperm sample is given, we usually have the sperm results within about 2 weeks. As far as the male genetic carrier screening panel, we usually have that within about 3 to 4 weeks. So it's not too long.
Okay, awesome. Can you talk a little bit about the diversity of the donors you have? The specific question asked what percentage of donors are non-white, but I think it would be helpful just to describe
That's a hard question to answer because a lot of our donors are of different ethnic backgrounds, but they label themselves as Caucasian. So it's really difficult. And typically what I tell recipients that are trying to access the database or going to the database for the first time, I tell them not to limit their search because she may be listed as Caucasian, but she may have Native American ethnicity or background. So I try to kind of steer them away from limiting their access by just saying, just see what's available. And if you need to do a specific search, let me know, because we also have donors sitting in our potential side of things that haven't fully completed their profile yet because they're still waiting on family history information. So if you don't see it in our active, I just ask them to send me a specific list of what they're looking for, and then I will look through what's in our potential to see if there's anyone that matches that.
I don't know if y'all feel this way, but I feel like you can tell Shawnee's an expert in this because that was very well-answered question. We have another question on the screening of the donors. Did the donors undergo genetic carrier testing? And if so, how many markers?
We use the Semaphore genetic carrier screening panel, which at least as of currently, it has about 283 genetic carrier conditions included.
The next question is, does the donor participate in the matching process?
I'm not really sure how to answer that question because the donors are anonymous as the recipients are. So donors really don't ever know who they're donating to. They just know that there's a recipient family interested in utilizing them.
Okay. I get that makes sense. And I'm just trying to see if the same person would like to, if that person would like any clarification, please let us know in the chat and I'll pull up your question as soon as possible. How do you know that the donor is being honest about their medical history and their criminal background check and all of those things?
Well, so we do offer team genetics counseling for the donors. That right now is not included in the Matching Miracles fee because it is something that is newer to the program. But it is taking a step further about what they said on their application. Their Semaphore testing, and it's basically a geneticist that speaks with them one-on-one to get more family history information.
Back to the question that you had asked for a bit more clarification on. This person had asked if they have any say on who they match with or in the matching process.
The recipients always have a say on who they match with. They're the ones choosing the donor.
Does the donor have any say? Does the donor have any say? I'm sorry, I should have clarified.
No, they're signing up in the process of helping a family. They don't, again, they're staying anonymous to the recipients, and the recipients are staying anonymous to them, so they don't know who they're donating to. They just know that it's a family that's in need of their help.
Sure. Will the donor profiles be able to tell you if they've donated before, and if so, how many previous eggs were given, or does it give any information about their donor history?
So the profile does not give that information. Profile is their medical history and family and themselves. When they send me, they being the recipients, when they send me their top 5 list, I send them information on if the donor's ever cycled before, if so, what the outcome of that cycle was. But they have to understand that the outcome is probably not going to be the same because the male side of things will play a factor in their outcome as well.
Can you talk a little bit about the difference in success rates between the Fresh Matching Miracles program and the frozen options?
Since our Matching Miracles program has been present, we have been fortunate enough to see about an 85% ongoing pregnancy rate. So that's with these freshly used eggs. With frozen or cryopreserved eggs, the success rates are also quite good, but they're more in the 50–55% range. So there are going to be some differences, but certainly there's a huge advantage to using an egg donor regardless of whether it's fresh or frozen. But there is a bit more of an advantage in terms of ongoing pregnancy rates to have all of the eggs there at one time, like you would get with a freshly collected egg retrieval.
And we have had a few questions come up around pricing. I know these type of questions are always best answered sometimes in an initial consult once you've been able to do a full workup and understand their history. But can anyone give a brief overview of what pricing would be for the 2 different options?
So with Matching Miracles and its all-inclusive package, it is a $35,000 fee. It does include pretty much everything that you can think of for a donor cycle, including 2 embryo transfer cycles for the recipient, whether the first one is successful or not. With frozen eggs, it is very dependent on what cycle you choose to move forward with the frozen bank themselves. So MCRM's fees are not included usually when you're working with a frozen program. And the program that we're partnered with, the Assured Refund Program, is upwards of $40,000, not including MCRM fees.
Thank you. And if anyone has any additional questions about that, we do have Dale on the line, who is the marketing director for MCRM Fertility, and we can share his email too. So if you wanted to ask more direct questions about that, that is an option for you as well. We have a question about is it possible to find out information about the donor's immediate family?
So they're completing an application that does request immediate family information. So physical attributes, their height and weight. I mean, obviously it's probably a generalized height and weight because not everybody will be truthful about their exact weight. But it is a generalized height and weight for their immediate family. If they have siblings, it does ask for their information as well. Some donors go above and beyond and list everything that they know about their genetic history, from great aunts to great great uncles. Sometimes a benefit, but sometimes also a downfall. But like I said, if there is ever a question about their genetic history or information that's lacking, I can always reach out to the donor to get more information for that recipient.
Awesome, thank you. This is actually a really good question. Do all of the donated eggs get fertilized at the same time, or can you save some of the eggs for later use?
I would say the intention is to fertilize them all at the same time with this type of program rather than freeze the eggs for later use, because the whole advantage of having multiple eggs to work with at one time is because not every egg will develop into an embryo, even when it's coming from an egg donor. So the advantage of having multiple at one time is you get multiple chances each time. No matter how many sperm there are, they're always going to outnumber the eggs. So if you're really only going to fertilize a small number of those eggs, you're not really getting the full benefit of the Matching Miracles program. I think that if the intention is to only fertilize a small number of eggs, then that may be a situation to maybe consider using the frozen eggs.
So this question asks about thaw rates, so it might pertain a little bit more to frozen, or it would. So what is the donor egg thawing rate? And what's the ratio of blasts that is achieved? So that, I'll let you guys explain that.
So that is a great question, and thank you for asking that. However, the answer is going to be by clinic, because every clinic has different technicians that are trained in the same way for thaw and fertilization of frozen eggs for donor egg bank. So it's not a consistent thaw to blast ratio. They do it on a nationwide basis, not clinic by clinic. So it's really hard to answer that question. I can be more than happy to get that information from our lab director, Dr. Gleed, and send it to that particular person that's asking the question, but I don't have that information off the top of my head.
I will tell you though, in our partnership with Donor Egg Bank, we also recruit donors and have them undergo IVF with an egg retrieval and then freeze their eggs to be used countrywide. And our laboratory and lab director have won national awards for how the eggs generated from here perform. So I think that on the whole, if they've been generated from here, they do pretty well. As Shawnee mentioned though, when people are recipients from an egg bank, the eggs could really be coming from any number of clinics. I think overall, Donor Egg Bank has a fairly high freeze-thaw survival rate. I think it's going to be somewhere in the 80 to probably high 80s in terms of percentage survival.
Thank you. This question, I hope I'm pronouncing this right, is the result from the SEMA4 available in the donor database?
No, it is not, because it is their personal medical record, but it is given to the recipient, because obviously that's something that the recipient needs to know when they're choosing a donor, if they tested positive for a carrier screen and what they tested positive for. That way they know that the male recipient end of things needs to be negative for that particular carrier status.
That's actually all the questions I see listed in our chat function. Is there anything else that the MCRM or Matching Miracles team would like to add, or if anyone else has questions, feel free to add it before we kind of tell you about next steps and a little bit how you can make an appointment if you're interested in learning more.
I guess my only final thought is this is a treatment that has allowed patients that otherwise would not have been able to have a family an extremely viable chance to finally have the family of their dreams. And so we're all just really excited to be able to provide this.
I could not agree more with what Dr. AUBUCHON just mentioned.
So if anyone on the phone, I'm actually going to turn it over to Dale, who could talk a little bit about if you guys are interested in learning more or doing an initial consult and talking more about your own personal situation. Dale, can you share a little bit about what's the best way to set up an appointment or get in touch with you folks?
Sure, there's a couple different ways that you can go about. Number one, you can visit the MCRM Fertility website, go to request a consultation and complete that form in detail. We'll be glad to reach out to you ASAP and help get you squared away with an immediate consultation with Dr. AUBUCHON or Dr. Ollering. You can also call us, 636-778-9899 is our main number. Our Tulsa number is 918-615-8484, and our website again is MCRMfertility.com. Or you can also visit the Matching Miracles website at matchingmiracles.com. And there's also additional information that you can request under the intended recipient families section, and you can request additional information from there. We'll also get you connected and set up for consultation with one of the partner MCRM physicians, Dr. AUBUCHON or Dr. Ollering.
So something you said must have sparked some ideas. So there actually was 2 more questions that came through. If y'all would like to stay on, because they are very good questions. Does the fee that Shawnee, you mentioned, include the donor travel expenses?
To a $500, yes. There's a $500 travel expense included, whether that is for hotel stay and air travel or mileage and hotel stay. There is a $500 travel expense in that fee.
And are donors from across the country and from all locations, or regional to your offices?
I would love them to be across the country, but right now it's within a 6-hour to 8-hour radius of MCRM Tulsa and MCRM St. Louis.
And last question, will the SEMA4 results be made available before the recipient makes a final selection?
As long as the donor has had that testing done already, yes, it will be made available when I get the top 5 list and provide that information to the recipients. If it's a first-time donor, they have not undergone screening yet, so they may not have that available quite yet. But at some point, before a recipient makes the final decision to move forward with that donor, yes, the SEMA4 results are given to them.
Amazing. Thank you all. We will be sending a follow-up email with all the information that Dale just listed. But just want to say thank you so much for joining us, Dr. AUBUCHON, Dale, Shawnee, you're amazing. And we appreciate you guys. So thank you for joining us in your evening, and have a beautiful night.
Thanks, everybody.
Bye. Thank you.